good afternoon, Mr. Johnny D. How are you?
Hi, how you doing? All righty.
My name is Jessica. I'm from Respiratory. How are you doing?
All right.
Okay, can you please tell me what's your date of birth, please, and your full name?
04/27/96.
Okay, and what's your full name, please?
Johnny Daniels.
Okay, all right. So let me just make sure. Okay, all right, thank you. Okay, so I'm here today because your doctor just diagnosed you with asthma. Is that correct?
Yes, unfortunately.
Okay, so I'm here to talk to you about a asthma action plan. Have you ever heard of that?
No.
No? Okay, so let me ask you two questions before we begin. What language do you prefer?
English.
Okay, and how do you learn best?
For visual or maybe hands-on.
Okay, perfect. So I do have some information here for you. It's in English, and then I have some drawings and literature for you. Is that okay? Okay, so I'm going to go ahead and give you this. Once we're done, you can take it home, okay?
No problem.
All right. So when your asthma, this is your asthma action plan.
Okay.
I did some math for you, a little bit of calculations based upon your height and your weight
Okay.
that I got from your medical record. So based upon this, on your green zone, on your peak. Let me ask you: do you use a peak flow?
Do I use a peak flow?
Did the nurse show you how to use a
Yes.
peak flow? She did. Okay. So your peak flow, when you're from 454 to 363, that means that you're from 80 to 100. That is your green zone. What do you do on a daily basis when you're feeling okay?
Work. Sometimes I'll play a little basketball.
Okay. So then when you're in your green zone, you'll be able to go to work without a problem and play some basketball. Okay? And when you're in your yellow zone, you're gonna feel a little down, like not so good, not so much energy, a little bit difficulty breathing. And when you're on there and you're using your peak flow, you're gonna be anywhere from 358 to 227. Okay? When you're in your red zone, that means you're not feeling well, you're confused, you're slurring of speech, and you're just having difficulty breathing.
Okay.
You're gonna be less than 225. So when you use your peak flow, you're gonna blow less than 225. That's gonna be your important tool, okay? So I'm gonna give you this. You're gonna take this home and you can reference to this. And here is my phone number and my email, so you can go ahead and call me if you ever have any issues. If I don't answer, please leave me a detailed message. I might be with another patient, okay? All right. So when you're in your green zone, you're gonna be taking your Advair, which the doctor sent a prescription to you. I know the nurse showed you how to use that. And then also a prednisone. A prednisone is a steroid. When you're on your prednisone, which you just had some complications. You look like this. There's a lot of irritation. There's a lot of inflammation, and there's a lot of like swollen, and you're having your airways is closed, so you're having difficulty breathing. So what's going to help you with that is your prednisone. So the way we're going to start is with a higher dosage, just 40 milligrams 2 times a day. Then the next 3 days, we're going to do 20. And then for the last 2 days, we're going to do 10. Okay? So you're going to kind of decrease down, go down. When you're in your yellow zone, you're going to be taking your albuterol. You take that 2 puffs every 3 to 4 hours as needed. Do you know what an albuterol is?
No.
No? Okay, perfect. So I do have here a sample for you. You can go ahead and take it home. And we also send a prescription to your pharmacy, okay? So this is an albuterol. How you're going to use this is you're going to shake it really well before you use it. You're going to pull this cap off. This is your mouthpiece. You're going to put your lips tightly, form a seal around it, and you're going to puff it, and then you're going to go ahead and inhale. But since this is the first time you use it, you're going to do like this just into the air. It's called the priming.
Okay.
So you're just going to make sure words kind of get the medication circulating or going, and make sure that it's working properly, okay? It's working good. So for your first time, you're going to prime it. Then you're going to go ahead, you're going to tightly put your mouth around it, seal your lips around it, and you're going to push this down, and you're going to hold your breath for 10 seconds.
Okay.
Make sure the medication is getting to your airways and it's opening them up, okay? So then if you don't use this in over 48 hours, you just make sure you prime it to make sure, again, the medication is flowing, and that there's no little pollen or anything, garbage or anything on there. So, can you go ahead and show me how to use this? Let me see. How would you use it if you're at home? And this is your first time using it.
Shake it first.
Mm-hmm.
Make sure I prime it.
Okay.
It's the first time, or I haven't used it in 48
Hours.
hours.
Mm-hmm.
Okay. Tight seal around, far as with my lips,
Mm-hmm.
and inhale and hold for 10 seconds.
Correct. Yes.
Okay.
Very good. That's exactly what you're gonna do. And then how would you use this?
See, I would use this in my yellow zone, right?
Mm-hmm.
Okay.
Yes. And then you make sure you take this one with you. The other Spiriva, it's more of a bit more expensive medication. So So we prefer that you leave that one at home just to make sure you don't lose it. Sometimes insurances don't want to pay for another one if it's before the time you're supposed to get a prescription. With the Advil, what I do recommend is to keep it in a dry, cool place, not like in your shower because it's hot and it's misty and that's powder. It might clump. So you can go ahead and leave that just like maybe in a cool place area like your bedroom or any place that's not really hot, okay? Do you have any additional questions for me?
No, it's perfect.
Okay, so I'm going to go ahead and I'm going to leave your action plan. And then also along with that, when you do your peak flow, here's a log. If you can please document what your numbers are for me. When you come back in a month, we're going to go ahead and go through these and see if they've improved. Okay? So this is like a daily sheet. So I'm going to give this to you also, and these are your visuals, okay? So all this information for you. Do you have any other questions for me?
No, this is perfect.
No? Okay. Well, if you do have any other questions, don't hesitate to give me a call or go ahead and contact me via email, okay? All right. Well, you have a nice day. You can go ahead and come out with me this way.
All right. Thank you.
You're welcome.